9:12, welcome back. This story new this morning. The number of Americans eligible for a COVID-19 booster shot could soon grow. According to reports, Pfizer plans to ask the FDA this week to authorize its booster shot for anyone 18 and older. A lot of Pfizer recipients are eligible, but not everyone. The Fox medical team's Beth Galvin joins us live to talk about this. Beth, good morning. It's good to see you. How are you? That's such a pretty little scene there behind you.
Thank you, Danielle. I'm still working from home, so that's where I am, just outside of Atlanta.
Oh, I love it. I'm so glad that you're with us this morning because, you know, my husband and I were talking about this last night in terms of the eligibility for everybody, right? Who can get a booster now? And when do you think this new authorization could happen? And then who'd be allowed to get a booster then?
So right now, Danielle, if we're talking about Pfizer and you originally received the Pfizer booster and you want to stick with the Pfizer booster, you have to meet certain eligibility requirements. So you have to be 65 or older. You have to be somebody who has a high-risk health condition, when that's an awful lot of people right now, because we're talking about things like people who have, you know, a BMI of 25 or higher, people who have diabetes, people who have kidney disease, high blood pressure. Lots of common conditions make you eligible for the vaccine. And then it's also for people who live or work in high-risk settings where they're more likely to be exposed and get sick from this virus. And so that comes out to probably roughly maybe 80–85% of people who've, you know, received a Pfizer originally who want to continue with a Pfizer booster. That's the eligibility. This, if Pfizer applies and is approved, gets an emergency use authorization to sort of expand, it would include everybody who's 18 and older would be eligible to get a booster. So that would factor in all those other people who don't quite fit under that umbrella of, you know, age or, you know, health condition or working or living environment kind of criteria.
And then in a lot of areas, you have case numbers that are going down, right? You have hospitalizations that are way down in a lot of areas. And so you almost have to wonder why this push for this third dose for everybody now, and if it's really necessary. I know for me, I'd want the third dose. I've already had 2 doses of Pfizer, but is it necessary for everybody to get it? Because some people are saying, listen, I've got 2 and I want to be done.
So it depends on whom you talk to, but what they have realized from the science and the data that we have so far is that the effectiveness of the vaccine wanes with time. So after about 6 to 8 months, you really start to see a drop off in the level of protection that you get from those first 2 shots. The concern is that we could see sort of a replay of what happened last fall and winter, where the numbers kind of dropped. Then we went into Thanksgiving and we went into Christmas and people got back together and saw each other. And then we had this huge spike right after the holidays, the biggest spike that we've seen so far. So Danielle, I think that they're concerned, you know, that we are seeing some numbers going up in certain cold weather states, that we could be in for a rough winter. And we still have, even though we're doing much better, we still have a pretty high level of virus in the community.
Beth Galvin, thanks so much for joining us. Always good to see you.
Thank you. Okay, thank you, Danielle.
We'll see you again soon. It's 9:16. Let's turn our attention now to the weather. And Jamie, good morning, sir.
Danielle, good morning. A nice start to